More than just a meeting, really. Cameron thinks so highly of the ideas in this book, Nudge, that he has made the book required reading for all shadow cabinet members who call themselves the Nudge Team. Among their tasks, encourage people to quit smoking and to eat more healthily without having to implement rules. Convince them to do it. They're dumb. But this isn't the first dabbling in behavioral psychology for Cameron. He basically lifted all of the campaign slogans from Obama's 2008 campaign. Are you ready for change? Yes, change. A year for change. But different kind of change, I think, than what we have over here, or is it? I know the people in England who may be watching me now, they want to change a lot, yeah. I think people in England are kind of like us, though. They just want to survive. They want to make massive cuts. Nobody wants to change, but they're willing to if it means their country is going to survive. But how do they cut? Because their government spent too much. How do they do that? They have too many entitlements. How do they do that? Businesses are too heavily regulated. Government health care is too expensive. It's collapsing. Patients over there are drinking water from plants. Too much spending, too much regulation, government health care, too many entitlements. Wait a minute, are any of these things sounding familiar? Those are all the things that Barack Obama is pushing us into while the rest of the world is trying to get out of it. Isn't that weird? Do you remember Donald Berwick? His new chief of Medicaid and Medicare services here in the U.S., he said he was in love with Britain's health care. But he also said this. Listen.
Berwick knows that politicians and most of his colleagues say that a single health care system is a non-starter in the U.S. They argue that Americans with health insurance won't go for limits on where or when they can get care. Berwick points to a Dartmouth College study 2 years ago that says the best quality care is in areas with a minimal number of hospitals, labs, and doctors.
If as a country you could sort of wake up and give up this belief that more is better, we would have a rational supply of care exactly where we need it and not be wasting on oversupply. These are answers. They're just not answers we're willing to swallow quite yet as a country.
Can I tell you something? He is so right. I know I was out in Wyoming and Idaho and Alaska the other day, and I thought, man, if I got a big problem, I hope I can go to the hospital here, maybe in Montana. We are running into the fire that the people in England are trying to escape out of.